Well, this is firstly a really good example of partnerships between the Ministry of Health of the Royal Government of Cambodia, the People's Republic of China's International Aid Program, and UNICEF. So the three agencies coming together really to focus on the children in the northeast of Cambodia, looking at newborn health, looking at nutrition, looking at education, particularly pre-primary and primary education, and also looking at water and sanitation and hygiene in the 5 northeastern provinces where a lot of children are facing challenges despite some of the good progress that's been made. And the objective is really to help make sure that children have the best start in life and also go into school healthy, and their environment means that they are not going to succumb or fall sick to preventable diseases, whether that be through helping them get immunization, get better nutrition, improved hygiene, and of course making sure that their education is as good as it can be. It's in the northeast, so we got Stung Treng, Priyavihir, Ratanakiri, Mondulkiri, and Krachi. Well, that's part of the underlying principle of the partnership, which is to say if we're making some successes there, we've got some good pilot tests and good models, there's a possibility that with additional support from our partners such as the People's Republic of China, that we can expand other provinces getting the same kind of support. Yeah, well, the first 1,000 days, we call it the golden days of life, the first 1,000 days, which starts when a child is conceived in the mother's womb, and then at birth, and then on to the second year of life. That's the 1,000 days that we're talking about. So really we want to help families make sure that mothers are getting the best nutrition they can during pregnancy. Then when mothers need to get to safe delivery times and events, then they can get the best quality care they can in the rural primary healthcare services. And then during the early days, for example, the first 6 months of life, a child gets only breast milk, making sure that they get a good start in life, and then supplementary feeding and good diet as they grow older up to the age of 2. Of course, parenting skills at that time is really important, so that's another element of the project. And then we can get children into pre-primary and make sure they have good sanitation, good nutrition from them. So that 1,000 golden days is the foundation of life, and we want to make sure all Cambodian children, regardless of their circumstances and background, they get the best start in life. Well, I think the last few years, and maybe going back 2 decades, Cambodia's government has done pretty well. There's been good progress, but there's always in every country, there's always, where there's progress, there's always pockets of inequality and the need to focus on those vulnerable areas. So sometimes, despite best efforts of government, there are always going to be lapses or gaps. Part of the project is really to help fill those gaps and make sure that no child is left behind, particularly in the northeast, where we know that there's been progress, but there's also substantial challenges that we must meet together. Well, local leadership at the commune level and in the villages and in the families is really important. So there'll be an element within the project of communicating with local communities, communicating with families, even using modern technology such as mobile phone applications to help people understand what it means to be a good parent, what it means to give good nutrition. And through the government's mechanisms, reaching out through health workers, through primary school teachers, through kindergarten teachers, making sure they're also equipped with the skills to communicate with families and communities in the remote areas.